It's completely normal to be a bit confused about the options. The words and the names can be quite confusing with the different medications on the market. What we're talking about today is Sildenafil, better known as Viagra, and Tadalafil, better known as Cialis. Viagra and Cialis are the brand names. The generic version, the active ingredient, Sildenafil, and the active ingredient in the other drug, Tadalafil, I'll discuss in more detail here. Just to make it clear, they're not interchangeable. It's not comparing apples to apples, although they do work through a similar mechanism in the body through something called nitric oxide, which many are maybe familiar with substances in supplements, like nitric oxide boosters, pre-workout supplements, beet extract, a variety of things on the market that boost nitric oxide. But what I wanted to make clear in this presentation is what to expect with the medications, how long they last, and potential side effects. So the first that we're going to talk about is Viagra, or the generic version of Sildenafil. The old name for this, the original drug, Revasio, that was actually used for a condition called pulmonary hypertension. That's exactly what it sounds like, high blood pressure in the lungs. That's not something we're going to talk about here. But understand that Sildenafil, depending on the manufacturer, comes in 20, 25, 50, and 100 milligram doses, or size tablets, if you will. It depends on the manufacturer. The brand name drug is produced by Pfizer. I believe that's in France. But in the U.S., a variety of manufacturers produce the generic tablets, typically in 20, 25, 50, and 100 that I alluded to already. The average range for patients is usually around 50 to 60, but there is plenty of evidence from the urologic societies in America that 100 milligrams, if there's not risk or contraindication, may be an acceptable starting dose for many men. And obviously, it depends on what's driving erectile dysfunction, whether it's psychosomatic, psychological, stress-related, nutrition, diet, medication, side effects. A whole host of things need to be taken into account when considering the cause of that. That's a topic for another discussion. But just understand that this drug is best taken on an empty stomach. If there's fat in the stomach, particularly a fatty meal, it will bind the drug and it will result in a couple of possibilities. One, increased time to onset, or you could say that another way, delayed absorption. So you take the medication, nothing happens, and then you wake up in the morning and raring to go. That's something I commonly hear from my patients as they went out to eat, had a huge meal, took the drug, and got home for some activity and were disappointed. That's one possibility. The other possibility is that it gets excreted without absorption into the urine and stool, and sort of a waste of the cost of the drug itself. So that's certainly a factor in planning around using Viagra or the generic version of Sildenafil, which can be inconvenient. Obviously, spontaneity is reduced in that scenario, particularly those that are maybe in a new relationship or dating, or maybe a little bit embarrassed about reliance on the drug. This can be a factor. ED is very, very common. The percentages would probably shock many people listening to this. I've covered that in some other videos and also in the ED course I teach online at Thinkific. Next, moving on to Cialis, or Tadalafil, which is the generic version of this. Again, this is produced in brand name and also by a variety of generic manufacturers across the United States and worldwide for both of these drugs, essentially. And the common dose, anywhere from 5 to 20 milligrams. There is a 2.5 milligram, but in truth, I have very few of my patients that take that small of a dose. I would say probably less than a handful in the last 5 years have requested the small dose. 5 milligram dose can be taken as needed or daily. It does have the benefit, when taken daily, for prostate health issues. It can relax the prostate and help empty the bladder. So for men that are facing some prostate issues with age, which also is very common, and erectile dysfunction, is sort of killing two birds with one stone. Obviously, it can have some side effects. Both Cialis and Viagra can lower blood pressure a little bit, so side effects for some patients can include dizziness. We'll get to the side effects of these in more detail in a minute. The benefit of Tadalafil or Cialis is the duration. this drug can last much longer in the body, depending on a person's metabolism, anywhere from 18 to 36 hours. So some people call it the weekend pill, where potentially it could be taken on a Friday and be theoretically in the body, allowing enhanced sexual performance throughout the weekend, which removes planning from the equation. It can be taken with or without food, so that also removes planning from the equation. The other caveat or point to note about any ED medication is these generally should not be combined with alcohol. The combination of ED medication and alcohol can lower blood pressure and increase the risk for serious side effects. Moving on to side effects in general, these medications, because of how they work, their mechanism of action in the body, cause side effects which are very common and overlap despite what medication is taken. And the typical side effects that we hear about in our men's health practice: number 1, stuffiness in the nose or sinuses. Number 2, flushing or sensation of warmth in the face. Number 3, headache. Number 4, acid reflux or heartburn. And then some of the other side effects that are peculiar due to the number of receptors in a particular tissue inside a person's body would be a blueness or discoloration of vision with Viagra, back pain, more common typically with Cialis, just due to the receptors and some of the skeletal muscle in the body. Very rare side effects include priapism, which is a prolonged, sustained, painful erection, which is actually a medical emergency. I've treated this multiple times in the emergency department, and is something that is treatable, but swift action is required. Unfortunately, I've had a few patients that have been embarrassed and waited too long and ended up with a permanent penile damage and dysfunction and scarring despite aggressive surgical effort by the urologic surgical team. So I hope this sort of clears this up a little bit, just to summarize, the differences and to help make a little bit more clear about duration of action, best use case scenario, and potential duration of how the drug might work in the body. So take care, be well.